Good morning from the Oklahoma Insurance Department. My name is Rachel Fan and I work in the Communications Division here at OID. Thank you for joining us for our Medicare Mondays webinar series. For your awareness, I do want to mention that this webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OIG is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you can't reach an agreement regarding a claim. If you would like to reach out to us for help, or if you have any questions, you can call us toll-free at 1-800-522-0071, or you can visit our website at oid.ok.gov. For today's webinar, you will be able to see and hear us. However, we cannot see or hear you. If you have a question, please type it in the chat. At the bottom of your screen, you will see several options, one of those being chat. And if you click on that, you can type your question there. We will save time to answer questions at the end of the webinar. Now I'd like to introduce our speaker, Ray Walker. Ray is the Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. Mr. Walker has 20 years of experience working in and around the healthcare industry, primarily in insurance, and has had the privilege of speaking to groups across the state and around the country. Ray, over to you.
Good morning. I'm trying to figure out how I can get my full screen back up where I can see it. I'm going to ignore it and just go ahead and move forward.
Ray,
glad
we can
everybody
see your
could
screen,
join us.
I confirm.
You can see the full screen?
Yes.
Okay. I thought I had really messed things up.
No, we can see your screen, so you're good to go.
Okay. Hope everybody's getting ready for the holidays, and we are in the process right now of wrapping up the open enrollment season, which ends this Thursday. If you've not made that decision, you need to get on that because time is running out. So if there's anything that needs to be questioned or researched, please get on the phone with one of our counselors and let's address those issues. So let's go ahead and get moving so we can talk about our topic for today. Oh, before I do, I need to remind everybody, our program is a division of the Oklahoma Insurance Department that is funded by federal grants. So we have grants that help us to assist people with all things related to Medicare, whether that's the parts of Medicare, Medicare fraud, assistance with their Medicare costs, etc. Today, what we're going to focus on is what's changing for 2024. Some of these topics we've already mentioned in previous webinars. I want to reiterate those, but also go over some of the new stuff, as well as looking at how some of this dovetails together with other changes. Now, we talked about this one previously. The cost of living increase on Social Security was 3.2% for this year. The significance of that is that for most individuals, that increase is more than what it's going to take to cover the increase that we had on the Part B monthly premium increase. Part B went up about $10. The 3.2% cost of living increase on Social Security means that most seniors are going to have some money left over after that Part B increase. So that's kind of a nice thing. We had several years there where pretty much the increase that people received on Social Security was a wash. They really didn't get anything extra out of that. So this is a good thing. Part A costs, pretty much flat. There really wasn't a lot of changes in terms of premiums for Part A. However, there was a little bit of a bump on the deductibles. We saw a $32 increase on the Part A deductible, and then the cost per day after day 61 went up just a little bit, as did 91. So that was a little bit of a shift there as well. Part B, I mentioned earlier, went up almost $10 a month. And for those people who are in a higher tax bracket, we're going to look at a slide here in a second that shares some new information about those individuals. And then our Part B deductible also went up. It went from $226 to $140 for the year. That's not a benefit period. And then after that, as usual, Medicare Part B is going to cover approximately 80% of your costs, leaving you with 20% of those costs. Now, here's the IRMA brackets for 2024. And I hope this is big enough for everybody to see it on your screen. What's mostly significant about IRMA in terms of changes for the coming year is in the past, the threshold where people started paying IRMA cost. IRMA, by the way, it's income related monthly adjusted amount. It's for those individuals who are in the higher income brackets. That threshold used to be $97,000 for an individual, and I believe it was $103,000 for a married couple. Or no, it was, I don't quote me on that one. The good news is for an individual now, that threshold is going to be $103,000. So it went up quite a bit. So before someone would be subject to the income related Medicare adjusted amount for their Part B, they would have to be making considerably more than they did last year. So that's a plus. That's a benefit that I hope some people are going to be able to take advantage of. As far as we know at this point in time, this system, IRMA, impacts less than 5% of all Medicare beneficiaries. So that's a good thing. Okay, next thing we want to talk about, the Medicare Part B immunosuppressive drug benefit. This was new in 2023, and I just want to clarify some things about this. We've got Medicare Part A, we've got Medicare Part B, which covers the outpatient stuff, the doctors and all that stuff. This is a Part B option that is specifically for those people who have had a transplant. Let's say this is somebody who has end-stage renal disease and they've had a kidney transplant. Those individuals have, once they've had a successful kidney transplant, their immunosuppressive drugs continue to be covered for 36 months on ESRD Medicare. But after that 36-month period, they're no longer eligible for ESRD Medicare, assuming that the kidney transplant is still successful. So what do those people do? If they're not eligible for regular Medicare, what's their options? So we started hearing about this new immunosuppressive Part B. It's $103 a month, and it pays for those continuous immunosuppressive drugs. So we're thinking, yay, this is going to be the solution for those people. But then we got to looking into this more deeply. We found out, one, it doesn't pay for any of the other benefits, like your typical Part A inpatient benefits, the Part B outpatient benefits, prescription drugs, aside from those immunosuppressive drugs, supplies, nothing. It literally only covers those immunosuppressive drugs. Furthermore, for a person to be eligible for this insurance, they cannot be eligible for any other type of insurance, such as group health insurance, individual insurance, including insurance on the marketplace, TRICARE coverage, Medicaid. So I'm not quite certain when we will ever see us using this benefit very much. I think it's going to be a very, very, very rare case. And so stay tuned. I'm sure there's going to be some fine tuning that takes place on this particular benefit. But for those who had heard about it, I just wanted to give you that bit of information that we've come across so far in research. Regarding COVID-19, that's gone through a lot of changes this year because we're coming out of the pandemic, thank goodness. For one thing, the vaccine is still covered at 100%. You don't have any cost sharing to get your annual, not a one-time vaccine, your COVID vaccine. Now, there might be some cost sharing for diagnostic testing. If you're not sure if you've got COVID and you go to the doctor, then it's going to fall under your usual Part B benefit. So you'll have to meet your deductible. You'll have, 80% coverage. Now, important point, Medicare does not cover the over-the-counter COVID-19 test. Those fun little tests where you shove the Q-tip, 6 inches up your nose and tickle the bottom of your brain. Those are not actually covered by Medicare. You can get them at the drugstore and stuff. Now, I do want to tell you there is a website that you can go to. It is covid.gov/tests. And you can get 4 free over-the-counter COVID-19 test kits sent to your house. And there, you can get 4 test kits per household. So I encourage you, take advantage of that. I've already sent off and got mine in the mail. We thought it was a Christmas gift, but no, it was just COVID-19 test. The other thing that is important to remember about COVID-19, telehealth benefits, those were expanded during the pandemic so that people were able to stay home and get some medical advice and stuff without having to go out and expose themselves. They are extending telehealth services through 2024. So an individual, maybe rural or whatever the case may be, can continue receiving those telehealth services, and not just specific to COVID. It can be related to anything that they can utilize telehealth services. This is a new benefit in 2024, chronic pain management and treatment. Now, this is not considered a preventive service because it's not preventative. As you can see from this slide, this is for individuals who have at least been living with chronic pain for 3 months or more. And the new benefit covers the assessment of the condition, medication management, which is very important when you're talking about people with chronic pain, because we don't want them getting addicted to painkillers and things like that, care coordination and planning. So it's covered at 80%. There is the website if you'd like to learn more about this particular benefit. Another new benefit this year is lymphedema compression treatment. Lymphedema, if you're not familiar, this lymph fluid is it's very necessary for your system. It gets pumped throughout your body, but for some people, those systems where it gets through the lymphatic system get clogged up, and it can cause some severe swelling, a lot of pain, and things like that. In the past, the compression garments that they used were not covered. Now they are, again, covered at 80%. So by all means, visit the website if you know of someone that might benefit from this, who's had to deal with it on their own or pay for it on their own in the past without any assistance from Medicare. This one's a big one. Very excited about this next change. For anyone who's worked in the Medicare system for any length of time, you know what a challenge that we've had having mental health providers in the rural parts of our state, which created a problem for seniors, who wanted to talk to a counselor. You had to be a licensed mental health uh, a licensed mental health social worker to receive licensed clinical social worker. I knew there was a term for it, to receive reimbursement from Medicare or above. We have a lot of licensed professional counselors here in Oklahoma, LPCs, that see a lot of clients, and they get reimbursed by private insurance and things like that, but not Medicare. So there's been a big push for a long time now to try to get them added to where they could receive reimbursement directly from Medicare. That has happened. So as of 2024, licensed professional counselors, marriage and family therapists can now get reimbursed by Medicare directly. In addition, Medicare will pay for intensive outpatient treatment programs, and these can be for mental health. They can be for opioid treatment. They can be held at outpatient departments, community mental health centers, federally qualified health centers, a variety of different venues where this can take place. So this is going to be a huge benefit to seniors across the state who have just been so limited on being able to get treatment. With the Advantage plan, so what we're seeing is that it looks like this is going to be the year where it's going to officially pass 50% of all Medicare beneficiaries will be on a Medicare Advantage plan. Now, this is nationwide. This is not Oklahoma specific. For Oklahoma, the average monthly premium is $17.34. However, most people are on a plan that has a zero monthly premium, and most people are not going to see an increase in their current premium. If they stay on their current Medicare Advantage plan, the premium isn't going to go up for next year. The number of plans nationally went up. However, in Oklahoma, it actually went down a little bit. It went from 89 to 80. This wasn't really this wasn't anyone leaving the market. They weren't exiting the market. What this was actually was consolidation. There were some plans that had two different separate plans that were very similar, and so they just consolidated them into one plan. So we really didn't lose any carriers on Part C. The benefits this year. I'm sure everyone has seen how a lot of the supplemental benefits, the dental, vision, the little credit cards where they can get over-the-counter stuff, meals, all of those benefits are expanding significantly. So for some seniors, that could be a very beneficial thing to have. However, we still stress to people, don't choose your plan specifically on those additional benefits. It's still mostly critical to make sure that you can receive the healthcare services that you need. So make sure your doctors are in the network and all that stuff. And then these other things are just kind of on the side. You know, they're nice to have. You know, if you are somebody that needs some transportation assistance, I always encourage people. There are other transportation services in a lot of communities around the state. Contact your area agency on aging and see what they might offer in terms of transportation in your area as well. Part D prescription drug coverage. There's 22 plans available in Oklahoma this year. It's down from 24. The most significant change that we saw this year was we have fewer Part D extra help benchmark plans, the low income subsidy benchmark plans. Now, what that means, when a person qualifies financially for the extra help program, which helps with their monthly premiums and their copays for their prescription drug plan, uh, there's only certain plans that they can enroll in that will be under that benchmark monthly premium and allow them to have no monthly premium for their Part D coverage. For 2024, or for, excuse me, let me step back. For 2023, we had 6 different benchmark plans available in Oklahoma. At the beginning of 2024, we had 4 benchmark plans that were available. However, recently we were informed that Clear Springs has been sanctioned. They will no longer be offering Part D benefits after 2024. So they cannot accept any new Medicare beneficiaries. So now we're down to 3 benchmark plans. So it's very important that you make sure if you're on extra help or if you're a professional and you're helping somebody that is on extra help, make sure that they're looking at those benchmark plans. Here's how you identify a benchmark plan. If you're looking in the Medicare and You handbook, at the back of the book where they list the different Part C plans and the Part D plans, and it gives you all that information about, you know, what the plan is and what their contract number is, where it gives you the premium amount. If that premium is written in blue, that is a benchmark plan. And so there are 3 different benchmark plans. So, you know, make sure that you're looking at those plans. Blue Cross Medicare RX Basic, Humana Basic RX, and WellCare Classic are the ones that we still have available in Oklahoma. And I know that doesn't sound like very much, but guess what? There are some states much bigger than our state and some that have a lot more seniors, like Illinois, that have 1 benchmark plan available. So not sure what's going on, but ouch. This is just kind of a really nice graph that the Kaiser Family Foundation put out that kind of shows you what this shift looks like. If you look back at 2007, we had 56 different Part D drug plans. And what this is looking at is how are seniors getting their prescription medication? We had 56 different drug plans in 2007, which, if you don't know this, that's the second year. The first year we had Part D plans was 2006. 2007 was the second year. And we only had 16 Medicare Advantage plans. Look through the years how that has shifted so significantly to where now in 2024 we have 21 Part D plans and 36 Medicare Advantage drug plans. In other words, these people are getting, they're using their Medicare Advantage plan to get their prescription medications. So the times are changing. We talked about these in a previous webinar, but I want to reiterate the changes as a result of the Inflation Reduction Act, which are very significant. The big one that people have been hearing about for some time now is the cap on insulin at $35 a month for people who take insulin. Now, it's important for people because I don't know if anybody saw it, but I actually got to do a TV interview on Channel 5 this last, or 2 weeks ago, or this last week, I think it was, specifically about this, because what they were concerned about was people were hearing that there was a $35 cap on insulin, but they weren't paying attention to the fact that you have to still make sure that the insulin you take is on the formulary for the plan that you're on. You can't assume that just because you take insulin that it's 100% cap. It still has to be on your formulary. So please, make sure that the formulary that for your Part D drug plan includes all your prescriptions, including your insulin. Don't assume that because you are on, let's say, Humalog, and you take the generic for Humalog. Be specific. If it's the generic you take, put the generic on your comparison, and make sure that it's covered. Again, I encourage you, talk to one of our counselors. It's very easy. We're happy to help you, and we don't want anyone to start out the new year not being able to take advantage of this really great benefit. Also, the cost sharing on the adult vaccines, anything that's covered by Part D, the cost sharing has been eliminated. So if you've put off getting your shingles vaccine because you didn't want to have to pay, they were pretty expensive, by all means, get that shingles vaccine. I've had my first shot and I'm going for my second shot in about a month. It expands the eligibility for full extra help. Now, people have been eligible for partial extra help that were at 135% of the federal poverty level. And so they got a partial benefit. You had to be at 150% of the federal poverty level to get full extra help, or reverse those. People had to be at 135% to get full extra help, but people could get some assistance if they were up to 150%. Now, everybody at 150% or less can get that assistance. So they've kind of done away with the partial extra help. We're hoping that people are going to maybe have an opportunity who didn't qualify at all in the past. Hey, if you're not sure, go ahead and apply. You can call us. You can call the people over at Oklahoma Human Services. They also work in this program. Look for their website, Medicare and Medicines, and see if you can apply for this. Also, it eliminates the cost sharing when a beneficiary reaches the catastrophic phase. And I've got a graphic in the next slide that's going to talk more about that. And then also in 2025, it puts a cap on the out-of-pocket cost for beneficiaries who are on a Part D prescription drug plan at $2,000 a year. That means once your out-of-pocket costs reach that $2,000, you don't pay another thing for your prescription medications for the remainder of the year. So here's a graph, and I've used this graph in a previous presentation as well. Again, it's from the Kaiser Family Foundation. The first column you see there is what we're currently dealing with, 2023. A person pays 100% of their deductible, then they go into the initial coverage phase where they pay 25% of their drug costs approximately. Then the coverage gap, where again, they're paying 25% of their drug costs. Once they're out of pocket, reach that $3,100, then they went into what's called the catastrophic phase, at which point in time this year, they would pay 5% of their prescription drug costs. In 2024, that 5% is going to be eliminated. So people still will go through those first three phases, just like they did this year. And the out-of-pocket max is going to be a little bit higher. It's going up $150 to $3,250. But once they reach that out-of-pocket max, then they don't pay that 5%. They pay nothing for the remainder of the year. The following year, in 2025, that's when everybody will have that $2,000 max. So you'll pay 100% of your deductible. You'll pay that 25% in the initial coverage phase. And then once you reach $2,000, you're done for the year. So we're hoping that's really going to help a lot of people. Now, we also talked about how Medicare is going to start negotiating drug prices. And these are the drug prices for those incredibly expensive drugs that we see commercials about all the time on the television. I'm sure you guys recognize the names of some of these medications. Also, if you look at this list, the numbers next to them, that's the amount that Medicare has spent on these medications between 2022 and 2023. So as you can imagine, that's pretty good supporting evidence as to why these are the drugs they need to start with in terms of negotiating. So these are all Part D covered medications. Next year, they will select, I believe, 15 more Part D medications to negotiate. And this is what that timeline will actually look like. They identified the drugs that they were going to start negotiating on in September of this year. And in October, that process started. Their goal is to have the process completed by August 1st of 2024. And so that by the time, the prices are going to be in place by 2020, the end of 2024, so that by 2026, people are actually getting to pay these new negotiated prices. But that's not the end of it. They will start again in February of 2025, identifying the next group of drugs that will be negotiated moving through there. The following year, as I understand it, it's going to be a combination of Part D covered drugs as well as some Part B covered drugs. So we're really hoping that this is going to have a significant impact on what people are paying out of pocket for their medications. Now, the birthday rule on Medicare supplement insurance. We talked about this briefly earlier. For anyone who is on a Medicare supplement policy, this has to be, you can't be on a Medicare Advantage plan right now. You actually have to have a Medicare supplement policy. You now have the ability to switch to a different Medicare supplement plan during what we're calling the birthday rule. Every year for 60 days, starting on your birthday, you can go and shop for a Medicare supplement policy of equal or lesser benefits and see if you can get a better deal. And you have guarantee issue rights. That means that they cannot look at your current or pre-existing health conditions. It's a really great opportunity for somebody to get a really good deal on a Medicare supplement policy. We had a lot of seniors who were trapped, more or less, in a very expensive Medicare supplement policy. This gives them an opportunity to get that same coverage at a lesser price and to put a little pressure on the market to help drive those prices. So we're hoping this is going to make a big difference for those individuals. In the same rule, there's also new language that says for anyone who is on Medicare due to disability and has a Medicare supplement policy, that Medicare supplement carrier must notify them that they have a 6-month open enrollment period when they turn 65, during which they can purchase any Medicare supplement policy and they have guarantee issue rights. So this is just a reminder to those people that they were probably somewhat limited in their choices when they first got on a Medicare due to disability. Now that they're 65, the doors are wide open and they can kind of start over there. The income and asset limits for some of these assistance programs, unfortunately, we don't have all the information yet. We'd really like to see the information for, say, the Medicare savings programs. That information hasn't been released yet, but here, as you can see, is the information for Extra Help. That's the program I talked about earlier that helps with your prescription drug costs. So please, if you think this is something that could be helpful, we would be happy to help you with that. The Medicare savings programs, these are the programs that help with the Medicare Part A and Part B related costs. We're still waiting to hear the new income limits for this program. There's the asset limits that you can see right now. So please, again, we don't want to see anyone not getting their medical care because they can't afford those things. It's always worthwhile to go through the application process. Now, if someone is interested in applying for the Medicare savings programs, this is something that we kind of tripped upon that we want to make sure that people are aware of. Don't call and ask for the Medicare savings programs. That's kind of Medicare's name for these programs. Every state, this is a shared program between the state and the federal government, just like Medicaid is. So every state uses different names for those programs. And thanks to the work of our friends over at Oklahoma Human Services, they've kind of learned the lingo for us. So when you call and you talk to Oklahoma Human Services, here the contact information is here on the screen. Ask for Medicare Part B premium assistance, or ask for the Part B buy-in, or something like that. Those are the terms that they're going to recognize and be able to help you with. So please, reach out to those people and see what you can do. And I got some bad news. The hold time right now is extraordinarily long. uh, Please be patient. Don't go without these benefits. If you can, make yourself a snack, get you a bottle of water, find a good movie on TV, and then just sit there on hold while you're watching the show. But we're hearing of people that are on hold for like 2 hours and stuff. So please be patient. Okay, so here again are the agencies that we're contracted with around the state. These are the area agencies on aging. There are some community action agencies, Life Senior Services in Tulsa. Don't hesitate to reach out to one of these agencies if they are closer to you than we are. If you'd like to go in and talk to somebody, they are there to help you. We've got the counties listed as well. So please, if there's anything related to Medicare, Medicare fraud, assistance programs, take advantage of that. The counselors that are located at these satellite offices know how to reach us. If you've got a question that is maybe something they're not familiar with, they'll reach out and call us. We've trained them, they know what they're doing. Some things to keep in mind for next year. This is our last Medicare Monday for 2024. Here's what we've got in store for 2023. For 2024, we're going to skip January. Too much going on. There's a lot happening. But in February, first, we're going to talk about Medicare supplement insurance, kind of go over any changes that are taking place there, what it takes to get into a med sup, what are the things that people need to consider. In March, we're going to talk about low income programs, the Extra Help program. We're hoping by then we'll have all the income information for the Medicare savings programs as well as looking at what else is available out there. We're hoping to be able to look at the tools that are available online that people can go into and just simply say, this is who I am, what's available out there to help me. In April, we're going to talk about the Medicare Part D coverage phases, that system that we were looking at there that showed the deductible phase and the initial phase and all that stuff, to get a little bit more in detail about how those works. Then in May, Mental Health Awareness Month, we're going to talk about mental health and addiction treatment and kind of go over some of those new benefits. June, fraud, obviously. So we're going to be talking about Medicare fraud prevention. And in July, we'll talk about the Medicare appeals process. That's something that, kind of confuses people a lot of the times because it can get really complicated. A lot of people don't even know they've got the opportunity to appeal a Medicare decision. August, we're going to talk about Medicare marketing guidelines, getting ready for that open enrollment season. And then in September, we'll go over the fall open enrollment notices that people receive. There's certain letters that come out at certain times of the year. We want people to know what they should be expecting so that if something comes in that's not one of those notices, they know to be aware of it, maybe be somewhat suspicious of it as well. In October, we're going to get ready for open enrollment because it happens every year. And then in November, kind of, since we already have talked about open enrollment, we're going to go back and talk a little bit more about preparing for future healthcare needs. And then wrap it up in December, talking about any changes we know of for 2025. So I know that was a lot of information very, very quickly. We're a little bit over right now, but I appreciate that everybody has joined us. I don't know if we're going to be able to take questions or not, but what do you think, Rachel?
Thank you so much, Ray. Yeah, so I've been monitoring the chat, and the only questions we have are just regarding the availability of the slides. So just a quick reminder that all of our webinars are available to watch on demand at any time. You can go to our website, which is listed here on that slide, map.oid.ok.gov, and we've got an educational videos tab. And so you can just click on that and see all of our webinars for Medicare Monday for this year. And this webinar should be posted by tomorrow. So if you guys have questions on that, that's where those can be found.
Okay.
And,
Thanks, everybody. I
Ray shared
appreciate you joining. What?
Oh, I was going to say, Ray shared some great information about our 2024 webinars. And so if you're curious about how you can sign up for those, again, visit our website after the new year, and we'll get that registration link available for everybody there.
Okay. Thanks, everybody. Thank you for joining us today and for the previous webinars. And we hope everybody has a Merry Christmas. Bye-bye.